Hi, I'm Paul. I'm an anaesthetist at Southern District Health Board, and I look after you when you go to sleep for an operation. Anaesthetists are doctors. A lot of people don't realise that we are doctors. We go through the same medical training as all other doctors, and then we specialise as anaesthetists. That takes about another 5 or 6 years, but it's not too bad. We get paid while we're doing it. It's just like an apprenticeship, and we sit a few exams and then we're qualified to look after you. It's a great job. I really enjoy it. It's lots of fun, and we get to meet lots of people, which is really nice. Anaesthesia is a very humbling specialty in that rare things do happen. Anaesthetists work quite a lot and we see quite a lot of patients. So we will get patients who react allergically to drugs. That's what you're trained for. That's why it takes 5 or 6 years to train. You don't need to train for 5 or 6 years to do a simple anaesthetic on a healthy person, and you could teach most people with a little bit of common sense how to do it in a couple of weeks. It's probably a slight exaggeration, but it's not that far off. It really is that simple. But we do the 5 or 6 years so that when things go wrong, we can look after you and take good care of you. Well, we like machines and anaesthesia, and we like gadgets, and we like technical stuff. The machine you can see behind me is an anaesthetic machine. They're not cheap. They go for about $150,000 all up. And it's actually a mix of two different machines. The piece down the bottom basically is a gas delivery system. And what that lets us do is give you a precise concentration of oxygen, and we can raise it or lower it as necessary. We can add nitrous oxide, which is old-fashioned laughing gas, which provides pain relief and makes you a bit sleepy. And then we can control the amount of anaesthetic gas we give you. Now, the anaesthetic gas is what usually keeps people asleep. We do have other ways of keeping people asleep, but that's the most common. And we have two main gases we use, and as long as we leave them on, you stay asleep, and when we want you to wake up, we turn them off. The bit at the top that looks like a video game screen is our monitor, and so that monitors your blood pressure and your heart rate and your oxygen saturation. It monitors the amount of gas we give you, and it will also do the invasive monitoring, so that's intra-arterial blood pressures and central venous pressures. And there's also a piece on the side which is the ventilator, and so if we want to do your breathing for you, we'll hook you up to the ventilator. There's often a trainee anaesthetist in a training hospital like Dunedin Hospital, so an anaesthetic registrar, and there's an anaesthetic technician. Now, anaesthetic technicians are like our right arms, basically. They look after our equipment for us and they help us do everything. And so when we're meeting with you, we're basically looking to walk through the anaesthetic, what we're going to do. You know, we're going to say hi, we're going to pop the IV in the back of your hand, put on our monitors, give you some oxygen to breathe, pop you off to sleep, and then possibly if we're going to do something else once you're asleep, even as simple as putting in a urinary catheter or putting in an epidural or putting in a nerve block, we'll talk about that. And then post-operatively we'll talk about pain relief and what they can expect and what we'll do, and any side effects. You know, if you feel sore or sick or anything, there'll be more stuff charted, so you can have that. It's also an opportunity for you to ask us any questions you've got. If you want to know what are the risks from my anaesthetic, what could go wrong, what can I do, anything like that, then that's the time to ask us. And we don't mind being asked questions. We're happy to talk. Most of the anaesthetists are a bit like me and talk too much. So, you know, we're happy to have questions. You want the best possible anaesthetic, so they wake up and they're nice and comfortable and they don't feel sick, and everything is good. The best part of my role is giving someone a nice anaesthetic where they wake up, they don't feel sick, they don't feel sore, and it's gone as smoothly and pleasantly as possible.